Hello and welcome to our podcast Public Health Uncoded with Dr. Saroj Pachauri, brought to you by Centre for Human Progress in partnership with the POP movement, where POP stands for Protect Our Planet. Dr. Saroj Pachauri, a public health expert, provides commentary on some of the major public health issues of the current times and the various determinants of public health at play with high risk and vulnerable groups. Every month, Dr. Saroj Pachauri, a doctor of medicine and a distinguished public health scholar with over 60 years of experience, will unpack key public health concerns and opportunities in the current global arena with evidence and insights. I'm your host, Drishya Pathak, and as always, I'm joined by our expert, Dr. Saroj Pachauri, and our guest expert for today's discussion. Our topic for today's episode is the COVID-19 pandemic, a topic that has become all too familiar to all of us. It all began almost 3 years ago when severe acute respiratory syndrome, coronavirus 2, caused an outbreak of respiratory diseases, COVID-19, and pneumonia in Wuhan, China. Since then, we have been bombarded with a wide range of symptoms and information on how to treat the virus. This has continued for so long that people have switched off the information mode and tried to do about their daily lives. That's not the case for those of us in the healthcare industry. This topic has gained even more significance as the WHO chief recently declared an end to the global health emergency of COVID-19 on May 5th, exactly 1150 days after it first started. Today, we have the pleasure of discussing COVID-19 with our guest, Dr. Bulbul Sood. Dr. Bulbul Sood is a highly accomplished medical professional with extensive expertise. Dr. Sood serves as an independent senior strategic advisor and has held leadership roles throughout her career, including former country director for Jhpiego-India and Centre for Development and Population Activities, India. Dr. Sood's area of expertise include reproductive, maternal, newborn, child, and adolescent health, non-communicable diseases, women's cancer, infectious diseases including COVID-19, health system strengthening, and international health. She is a prolific writer with over 40 published articles and contributions to book chapters. I would now hand over to Dr. Pachauri to take on the conversation with Dr. Bulbul Sood and uncode the topic COVID-19 pandemic for our listeners. Welcome.
Hello, Bulbul. Welcome to this discussion. I feel truly honored and privileged to have this opportunity to talk to you, Bulbul, because I know that you've had immense experience, first-hand experience in dealing with the COVID-19 pandemic from its very inception to date. And so your experience will undoubtedly be of great importance to anyone who wants to know and learn about the COVID-19 pandemic. And I also have to say that you have already been very, very generous in sharing with us your experiences with the COVID-19 pandemic in the two books that Ash Pachauri and I have written on COVID. The first book deals with the health dimensions of the pandemic and is primarily focused in India. The second book goes beyond the health dimensions to also address issues on education, on economic aspects, political aspects, media aspects, and is more global with several case studies from around the world. These books have both been published by Springer Publishers and are available, and we'd be happy to provide you with the links if you're interested in reading them. They are open access and can be downloaded anywhere in the world and read. So, Bulbul, thank you very much for that, for your very generous sharing. But today, I think we're going to actually have an opportunity to talk about the pandemic, which, in my view, and I think everybody would agree with that, is the largest, the most important, the most impactful event of the century. I don't think that in our lifetimes we are going to see anything more impactful. It has impacted every life in every country around the world. It has health impacts, it has mental impacts, it has impacts on lifestyles, it has impact on work styles. Every aspect of human life has been impacted by this pandemic. And so I think it is extremely important for us to try and understand what happened and what is happening. We know that it has gone through many processes of evolution The pandemic has evolved in several countries in different ways, and the virus has also mutated in different ways, so that we now see several subvariants of that virus, and the whole exercise has been extremely, uh, extremely, I would say, extraordinary, actually. I was just wondering, given the fact that we started the pandemic in 2019, and we are still getting so many cases around the world. Cases are continuing. We are still finding cases in the developed world and in the developing world. And I wondered whether what you think about this. What is your analysis of this? Do you think the worst is over?
Thank you very much, Saroj, for giving me this opportunity to talk with you. And as you mentioned, COVID-19 is a catastrophe which as I don't think we ever thought would take place. And the way the pandemic spread so quickly across the world is something which has never happened before. Coming to your question, that is the worst is over, I would just like to make a statement which was, was shared recently by WHO DG, who said, "We are not yet there yet, but the end is in sight. And now is the time to run harder and make sure we cross the line and reap the rewards of all our hard work." And as you know, the world saw this pandemic spread so rapidly, but also actions were taken at the country level, at the national level, at the global level, very collaboratively. And I'm happy to see that, we are closer to seeing this pandemic getting over. As you know, in India too, the fight against COVID-19 continues, but I believe, and the worst is over. The pandemic has now become an endemic disease in the country. And because of the hybrid immunity the masses have acquired due to both vaccination as well as the infections that they had because of the natural disease, has also added to the beginning of the end. Hence, the WHO has rightly said that the end is in sight. We also know from the previous pandemics of our understanding that in 2 to 3 years, the pandemic will cease to be a major challenge. And the data shows that COVID-19 is no longer rapidly spreading disease. Most of the cases which are happening all over the world, including India, are milder, and very few require hospitalization, thankfully. However, before we reach the end, I believe we must be careful during this journey, and it's important to keep following the COVID-appropriate behaviors like wearing masks, which also prevents other respiratory diseases like influenza. And also, I feel that it's important to continue wearing masks when we are especially traveling in crowded places or inside closed spaces like flights, where people tend to stay together for a very long time. And it's very important, especially those who have comorbidities. So I think simple precautions are going to go a long way, and hand hygiene and maintaining social distances are other important preventive steps that we should continue. Over to you.
Well, thank you. Thank you. This is, nice to hear an optimistic scenario that you have painted. And I think you're probably right. I think probably the worst is over with God's grace, and that we are hoping for a future that will maybe see the virus in the form of an endemic rather than a pandemic. But let's see. What did we do that made us reach this stage? Well, for one thing, vaccine was an important pillar in combating COVID-19 around the world globally. And the vaccine history for COVID-19 is quite unique. It's quite unprecedented at the speed, the unprecedented speed at which vaccines were developed globally and in India, and they were made available for emergency use. It has never ever happened in the history of public health that this situation has reached this level, and we have managed to do what we could to produce vaccines that were effective in combating, and they played a very, very important part in combating the pandemic. Now, this was done all around the world, but I think in the case of India, this is a particularly important area to examine because, in other words, the vaccine journey in India and what lessons have we learned for the vaccine in India, because India was on the forefront, certainly of the developing countries that were manufacturing the vaccine and making it available not only within the country, but even to other countries that could not afford the vaccine. So this is something that I'm very proud of, and India has been applauded for this. I'd love to hear your views on how India went through this vaccine journey and what lessons did we learn?
So thank you very much, Saroj, for you know asking me this question about the COVID-19 journey, vaccine journey in India, and what are some of our lessons learned. And I could not agree more with you that vaccine was one of the most important pillar in combating the COVID-19 pandemic all over the world. In India, if you look at the journey and what happened, I would say that in my country, the strategy was based on whole government approach. So then the entire government machinery very quickly was mobilized, and they had a strategy to look at how we should be looking at developing a effective, good, safe vaccine. And I think this was also because India knew that it had the ability. We had scientists, we had the infrastructure, we had very robust, I would say, pharmaceutical also, and experience of vaccinating almost 26 million children every year. So we in India were looking at this as a challenge, and it was a whole nation approach. So the entire country, we had the same approach. It didn't matter whether you were from the northern states or the southern state or you were union territory. It was decided that the entire country would be, quickly moving towards vaccinating its population, and also taking society into a partnership mode. So the government made sure that the nation was aware that this is what is coming and what is the importance of vaccinating, etc. And the entire strategy was based on science and evidence. So, there was a very, very strong group of scientists and bureaucrats, and the government leadership by our Honorable Prime Minister was there to look at, what is the evidence? And as I said, based on science. So in India, we had a graded response. And as you know, on 11th March of 2020, the virus was isolated at the Pune NVI. And Prime Minister Modi appealed to the scientists and researchers to work for vaccine and drugs for COVID-19. So it was something which was, as I said, being led by the highest level of our leadership. It was the Prime Minister of India. Regarding the vaccine manufacturing, India also worked in a mission mode with a goal to develop almost 5 to 6 COVID vaccines candidates for licensure. And also during this whole process, it was not just India. India was very constantly working with other countries also, and the scientists from other countries on how quickly we could, come up with a good vaccine. So as you know, the Covaxin, which is a totally Indian manufactured vaccine, it's an indigenous vaccine. Virus was provided by the ICMR on 30th April 2020. And the process of manufacturing was done in their Hyderabad lab. during this pandemic, they conducted a clinical trial on almost 24,000 subjects. And, the primary challenge studies and assays and other thing was done at NIV Pune. So we must give credit to our scientists who very quickly moved and worked during the very difficult time. And as you said, emergency use authorization for Covaxin was given on 3rd of January 2021. So from the time when the vaccine was made available by ICMR to Bharat Biotech, which was in April 2020, within such a short time, we were able to have a vaccine and which was also had a authorization. The other vaccine that India worked on was the Covishield, which was manufactured in Serum Institute of India in the Pune plant. And this was in Oxford AstraZeneca, which was from UK. Again, in India, they conducted a bridging trial on almost 1,200 subjects. And again, the emergency use authorization was given in January 21. So what I'm trying to say is in a very planned way, very quickly with the data, because, studies were also done, that we were able to have the vaccine manufactured in the country. Simultaneously, the Government of India also constituted a national expert group on vaccine implementation for COVID-19 as early as August 2020. And besides involving the Health Ministry, the other ministry like External Affairs, Expenditure Ministry, Pharmaceuticals, Department of Biotechnology, etc., were involved. So it was, as I said, a very, intersectoral coordination was taken care of. And the group prepared a strategy, what was a digital infrastructure for inventory we should have, what the procurement mechanism, prioritization of the population which has to be given the vaccine, the delivery platform which should be used, the cold chain maintenance, vaccine safety, etc. So, everything was taken care of, and things were done in a planned way and not haphazardly. And I think we must, as I said, both the leadership at the national and the state governments worked in a very coordinated manner, and and everybody realized there was an urgency. And you would be happy to know that today we have 8 COVID vaccines manufactured in India. And I was told we have a capacity to manufacture 5 billion doses per annum at the very low rate of cost of less than $3. So, and this is a time that when, now we have the vaccine and it can be used, and evidence shows that it is an effective vaccine. The other important thing which the Government of India did was, when we started manufacturing the vaccine, was prioritization of vaccine, who has to be given. And when we started the vaccination program in January of 2021, we started with the healthcare workers, then we moved on to the frontline workers, and then in March 21, it was anyone who was about 60 years or 45 to, about 45 with comorbidities. In April of 21, everyone above 45 was, we started vaccinating them. And then in 21, it was 18 years and above. And January 22, the precautionary doses were also given. So it was very clear that, we moved in a way where you first gave to the ones who was highest at risk and then moved down. And, what challenges can be when you have to vaccinate 1.3 billion people, but it was done in a very, very systematic way. Again, everybody has heard about the COVID platform, and that was something which was very developed very quickly in, I believe, in the less than 3 months' time. And that was used to give appointment and, time when the people would then go to these facilities where the vaccine was given. They were followed up, they were given certification, the second one and third one. So very, very systematically, we used the COVID platform to vaccinate not only people in the urban area, but also in the rural areas. And we had more than 100,000 COVID vaccination centers. In fact, more than 74% of these COVID vaccination centers were in the rural areas. And, there was a plan to, communicate with the communities, handle the hesitancy, and also the eagerness, because in the beginning, when the vaccine came, everybody wanted to get it. So we said, go slowly, but we have to first give to those who are, at higher risk, and then move on to the other population. And you would be happy to know, Saroj, that 97.5% of all doses were given free in India through the public health sector system. And I think that is creditable to both the government as well as health system, where the doctors, the nurses, other health workers, the community-based workers, in fact, played a very important role in mobilizing the communities and the people to come for vaccination. And we saw very little hesitancy when it came to COVID vaccination.
Let me interrupt you here for a moment, because you said hesitancy. And, only one point that I would like to add to your excellent, beautiful, detailed analysis of the journey of the COVID vaccine in India is the fact that there were issues of inequity globally. You said in India, people accepted, and yes, they did, and it was amazing. In fact, people stood in lines in developing countries waiting for the vaccine to be given to them, whereas in certain countries, and the USA is a particular example, where in many of the states, especially the Republican states, people refused the vaccine. So this is a real irony that where the vaccine was available in abundance, there were no takers. And where a vaccine was relatively less available, there were long lines for asking for the vaccine. And with this, I'm going to go on to the last question, which we'll deal with in a shorter time, if you don't mind, but a very important one. And that is that the one significant positive change that occurred during this period of the pandemic was the fact that public health came front and center. Public health came front and center, something that has never happened before. You and I, Bulbul, are public health professionals who have fought so hard for so long to convince governments to invest in public health, but in vain. It never happened. Now, finally, with this pandemic, the governments around the world realized the importance of investing in public health, and is a big positive change. I just want to understand whether you see there are any fundamental changes in how governments are responding now to this public health crisis. Do you think that we are better prepared to tackle future pandemics?
So, Saroj, I agree with you that, one thing good which has happened because of this pandemic is that everybody has realized the importance of public health, looking at data, analyzing the data, and evidence-based data, and then taking decision based on what is good, for a larger community. And, I see a sea of changes in the mindset of everyone around when we talk about changes happening in the country as far as, tackling not just the current pandemic, but any future pandemic, what we need to do. Again, as I said, in terms of investment and the government, because again, in India, the government is the largest provider of healthcare services. And so we came up with a Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, which is called is PM Abhim, which is easy to understand. And this is for next fiscal year 21 to 26 for 5 years. And there was a large sums of commitment for health infrastructure in the country. And the funds have been allocated through the National Health Mission all over the country. So it's not just in one part of the country, or, maybe not just in the urban area. It covers the entire healthcare system. And the objective of this particular mission is to strengthen the grassroots public health institution to deliver comprehensive primary health care. And the second objective is to meet challenges of current and future pandemic in diagnostic and critical care services. So if you really think, that they're really going in the right direction. The third is to expand and build on the IT-enabled disease surveillance system through a network of surveillance labs, which is, starting from the block level, going to district level and at the national level, and to support research on COVID-19 and other infectious diseases. So as you can see, the public health is the fulcrum of the entire, change which is happening in the country. The plan is to establish the district's integrated public health labs and also establishment of the critical care hospital blocks, which is going to be 100 bedded and 50 bedded critical hospitals or wings in all the districts, 602 districts of this country, establishing of a block public health labs. So you can see that a lot of things are happening in terms of infrastructure in the country. Also, establishing the whole system of hiring the public health specialists, having the lab people, microbiologists, and other things are happening. And I think everybody's realized, because of what happened in the COVID pandemic, that we have to be prepared. We should be looking at things more actively, and the surveillance system has to be strengthened. Another thing which has happened during the pandemic was the entire, I would say, the urban-rural divide has diminished. It's not totally gone, but it is definitely diminished. And technology has played a very important role. So during the COVID pandemic, we found again, when it came to, for example, training healthcare providers, we found that technology really helped. And, we were able to establish, using hub and spoke model, strengthening the capacity of healthcare workers from the primary, secondary, tertiary care level, and also tech-enabled, building capacity in terms of combating COVID-19 was some of the very important innovative models for strengthening. And I'll just give you some example. For example, we worked on home-based care of COVID-19 patients. Now, they were totally isolated, but we, used the technology again and came up with an app called TeleTrack, which was an integrated tech-based multilingual platform for monitoring of COVID cases who were at home, with the provision of consultation with doctors, nutritionists, and mental health counselors. And we found that since this work, now we are building TeleTrack integrated model for chronic care for various diseases like, say, hypertension or diabetes and other lifestyle disease. Another innovative idea, which was what we call as Swasthya Sampark, which is, health, getting to meet people. And again, a comprehensive post-COVID care technology platform was used for triaging and assessment of those who had recovered from COVID-19. Vaccination coverage, as I said, used a lot of COVID, and also enhancing the COVID vaccination coverage by digital runners, vaccine facilitators, etc. And so this was also especially used when we identified the pockets with low vaccine coverage, addressing equity by eliminating digital divide, and also building confidence for vaccine by addressing various myths and misconceptions people had about the vaccine. So I feel that definitely we are better prepared now to face any other challenge. I hope we don't have, as you said, another pandemic, but if anything, at least we are, close to monitoring and keeping track of what's happening using public health system.
Thank you very much for an excellent analysis, which is very promising, which is very optimistic, in fact, of what has happened in India. I wonder whether we shouldn't be also looking at what has happened in other countries, because what has happened in other countries is very, very different to what happened in India. And there are many other lessons, global lessons that we need to learn from what other countries have done or not done, succeeded or not succeeded, because it's not an epidemic, it's a pandemic that we're talking about. But nonetheless, I think this is a very good beginning. And I thank you again, Bulbul, for your excellent analysis, for your looking at nuances of the system and telling us about the various different uh, factors that have occurred, that have been actions that have been taken by the government, much of which is very, very promising and very helpful to understand and very optimistic indeed. Thank you so much.
Thank you very much, Saroj, for giving me this opportunity.
Thank you, Dr. Bulbul Sood and Dr. Pachauri. Today's episode was truly captivating as it skillfully weaved together various elements that played a crucial role in India's successful strategies against the COVID-19 pandemic. Dr. Bulbul Sood shed light on various key factors that shaped India's approach, emphasizing the importance of intersectoral coordination and adopting a comprehensive whole government strategy. As a member to the public health sector, I wholeheartedly agree with Dr. Sood's acknowledgement of the tremendous efforts made by India's dedicated scientific workforce. The newfound recognition of vital role played by the public health sector, as mentioned by Dr. Pachauri, marks a significant shift from the past. While substantial progress has been made during the COVID-19 pandemic, there is still much work to be done, particularly in terms of investing in healthcare infrastructure to establish healthcare as a robust foundation for our economy. I would like to once again draw our listeners' attention to the series of COVID-19 books mentioned by Dr. Pachauri at the beginning. Dr. Bulbul Sood, along with other esteemed scientists, have contributed their first-hand experiences to the literature of public health, ensuring that future generations can learn from these valuable insights. The first book in the series, Health Dimensions of COVID-19 in India and Beyond, and the second book, Global Perspectives of COVID-19 Pandemic on Health, Education and the Role of Media, serves as a testament to India's significant contributions at the global level in the fight against the pandemic. Our listeners can take pride in and find solace in knowing how India has played a crucial role in combating this global crisis. After today's enlightening conversation, my mind is abuzz with the anticipation of exploring other captivating topics that can be unraveled through these valuable conversations. I assure our listeners that they can expect the same level of awe-inspiring insights in future episodes of Public Health Uncoded with Dr. Saroj Pachauri, presented by the Centre for Human Progress in partnership with the POP movement. Till then, stay tuned.